Thank you, Abby. But thank you so much to everyone for coming today to hear from our guest speaker. I'm going to pass it off to Dr. Rojan.
Hi, guys. It's nice to meet you. I can't see any of your faces here, but my name is Rojan. I graduated from UBC Dentistry in 2020, just at the peak of the pandemic. So I'm excited to be here to share some tips, some advice about what I went through. You should know, though, I applied in 2015, so I was the incoming class of 2016. So things have changed a little bit, but for the most part, from talking with the execs, it doesn't seem like it's changed too much. And some of the stuff, it's always going to be useful regardless. So I hope you guys find this session helpful. And if you have any questions or if you know, anything specific that I can help with, just don't hesitate to reach out to me. I'm thinking Instagram might be the best way for you to reach out to me if you're comfortable with that. So I can definitely give my Instagram to the execs and you guys can, you know, message me there, or if there's anything else I can help out. Yeah. Okay, so the introduction, I kind of already told you guys, 2020 UBC dental grad. It was not a good time to be graduating from dental school. Unfortunately, our graduation got canceled. So I didn't have a graduation. I didn't get to wear the gown. It was March 16th, 2020, when all the classes went online in dentistry. So it was the last 6 weeks of our clinical basically transitioned into online. You know, it turned into PowerPoint presentations rather than doing clinical stuff. So it wasn't fun graduating in the middle of a pandemic, but I'm sure the last 2 years you guys have been, you know, experiencing it too. So I don't get to complain too much. I was actually a member of UBC Pre-Dental Society from 2012, so the end of my first year undergrad, to 2015 until I got in. So I found it to be a good community of other pre-dental students who are looking to help each other out and looking to inform each other as much as possible about the application process. And you know, I tried to stay during dental school. It was really hard to stay connected to the Pre-Dental Society. So now that I'm, you know, 2 years after graduation and I have more time, I thought it would be a good time to give back to the community and help out and, you know, see if there's anything I can do. So yeah. Okay, my undergrad story. All right, so basically these are more specific courses. What did I do my bachelor's in, what courses I took and things like that. So, you know, it's interesting because I've talked to so many pre-dental applicants and some of them know really early on that they want to do dentistry and some of them don't know till much later. For me, I was kind of in the middle. Everyone in my family, they were all either, you know, graduating, you know, doctors, practicing doctors, or graduating from medicine or applying for med school. So from an early age, I thought that medicine was what I wanted to do. I basically started gunning for med school when I was in grade 10. I started volunteering at Canadian Blood Services, Cancer Society, things like that. And when I got into UBC, I did my bachelor's in kinesiology and health sciences. And I think at the time you had to be 18 to volunteer at a hospital. So first year undergrad, I started volunteering at St. Paul's emergency department, and just to see what it's like, you know, to be a doctor or to get more exposure to healthcare. And, you know, I was just in the emergency as a volunteer. All I got to do was talk to the patients, talk to their family members and things like that. And what I found out was medicine was not for me for two reasons. One, I wasn't emotionally strong enough to listen to people's, you know, stories of disease and chronic illness and things like that. It would affect me very negatively for a long time. So I just didn't have the emotional strength to go into medicine. And then the second thing I noticed about myself was I'm a very restless person. I always need to be doing something with my hands, or I'm not having a good time. So, that was early on in first year undergrad when I decided that medicine was just not for me. And then because I'd been working towards this goal pretty much like since a young age, this is what I thought I wanted to do. And then all of a sudden I realized that's not what I wanted to do anymore. My grades actually started dropping because I didn't have that motivation anymore. And then one day I was just having breakfast with my dad and he asked me how school is going. And I said, it's not going well because I don't want to do medicine anymore. And I don't know what I want to do. I don't have any motivation. I don't have any goals. And he actually suggested, have you considered dentistry? It's close enough in healthcare to be, somewhat related to medicine, and it also involves working with your hands and doing procedures and things like that. So, that was probably late first year undergrad. That was when I started seriously considering and pursuing dentistry. So it was, for me, maybe it was too late because my first year grades were already low. And at the time, if you went over 4 years, I don't know if UBC Dentistry still does that, but if you went over 4 years at the time, they would drop your lowest average year. Do they still do that, Emily? Oh, they do. Okay, that's great. So that's great. So for me, I had to do that to take advantage of that option. In terms of what courses I took, I don't know if you guys still have to do the prerequisite courses. There's English 110, 112, and biochem and chemistry and biology. And I had to do all those courses plus the requirements for kinesiology and health sciences. The reason why I chose kinesiology, I think it's important to choose, you guys are already in undergrad, so you've already chosen your path, but choosing something that you enjoy doing so that you can do well in it. Kinesiology was what I was interested in. So in terms of the number of courses I was taking 4 to 5 courses per term. I wasn't really taking any summer courses because I wanted to have the summers for research and volunteering and, just enjoying my time off. In terms of when I took my DAT and how did I study for it, I actually took the DAT. I remember I took it 3 times. The first time I took it was in 3rd year. At the time, I don't know if it's the same right now too. At the time, you can only take the DAT twice a year in November and February. Is it still the same?
It is, but they're talking about changing that.
Yeah, okay. So the first time I took it, it was in 3rd year, November of 3rd year. I just wanted to see what the DAT was like. I'd heard about it, I'd heard about the PAT, and I just wanted to see what it's like. And I kind of went into it blindly. I hadn't really studied for it seriously. So obviously my score wasn't great. And then the second time I took it was November of 4th year. And that was the term when I was taking a pharmacology course, a biochemistry course. So I didn't really give it enough time to study. And the time that I seriously studied for it was February of 4th year. And in terms of how I studied for it, I can't remember if it was called the DAT Crusher, or it was basically this software where you would pay for it and then you'd have access to hundreds of questions in different areas. And then I studied the DAT Destroyer. I actually did take the Kaplan course, but I did not find it helpful. I found that it was more geared towards preparing you for the American DAT because there was a math and organic chemistry component. That said, if you guys are going to take the American DAT, I would imagine that maybe the Kaplan course is not a bad idea. But for me, I found that studying through doing as many questions as possible was the most helpful thing for me, as opposed to sitting in a lecture by Kaplan or Princeton or things like that. But it's important for you to know what works better for you, what works best for you. If you like lectures, then maybe you can take into those types of courses, but especially for the PAT, the more questions you do, the more your brain gets used to the angles, the squares, and I can't remember the different categories, but I would just suggest that you do as many questions as you can. In terms of the extracurriculars that I take, volunteering and overall tips for pre-dental students, so back to my story of at the end of 1st year, when this was the summer between 1st and 2nd year undergrad, was when I started seriously considering dentistry as a career path. And at that point, I didn't have any experience in the dental field, no shadowing, no connections to the field whatsoever. So what I actually did was I went on the UBC Dentistry website, the list of professors, and I emailed every single one of those professors, I remember there were 52 at the time, asking if I could shadow them and asking if I could just be a volunteer, non-paid research assistant with their projects. Because if you're a UBC dentistry professor, you have to have a research project on the side. So I just wanted to get as much exposure as possible. And I got a bunch of, some of them ignored me completely. Some of them just rejected me. And there was one prof, she was a prosthodontist, and she got back to me. This was back in 2012. And she was new to UBC dentistry herself. And she was from Quebec. She was really nice. And she took me on as a research assistant. And the interesting story is I ended up staying on with her for 7 years, even throughout, like for 7 years during undergrad and then during dental school, because I loved just, you know, her research projects. They were related to cancer and oral cancer screening and radiation to the oral cavity and things like that. So she worked at BC Cancer Agency. So I started shadowing. I would basically work for free as a research assistant with her projects. And I would also shadow her on the side when she was seeing patients. So overall tips for volunteering, I would say for me, doing something dentistry related was really helpful. I think it's important to, you know, definitely get exposure to something dentistry. You know, you could become, for example, right now we're having a huge shortage of certified dental assistants in the field. Maybe if you have time, if you're considering like a summer job, you could become a chairside assistant, which basically all dental clinics in the Lower Mainland pretty much need a chairside assistant. They would train you. It would take maybe 3 weeks to 4 weeks, but you get to assist a dentist, get paid for it too. And you get to see what really goes on in a dental procedure, what's involved in being a dentist. You get to see lots of cool procedures. They'll even teach you how to take x-rays, which is really helpful. And not only do you get the shadowing, but then you also get the experience. And, you know, that'll open up a whole world of connections to dentists, research projects, and things like that. That said, it's also, I don't know if UBC Dentistry cares about other types of volunteering, like non-dentistry related. If that's something that you enjoy, for me, I was involved with Canadian Blood Services. I was just a volunteer, sort of, you know, providing refreshments to the blood donors. And then Canadian Cancer Society, I would just do the April Daffodil Day twice a year or something. So there were things that I felt strongly about. But also it's important to not push yourself and not do too many short-term things. I think I know that medicine definitely, I don't know about UBC dentistry, but UBC medicine definitely values long-term sort of volunteering positions as opposed to a lot of short-term ones. So find something that you're passionate about and then maybe stay with them for a long time. And who knows, you know, maybe if it's something that you truly enjoy doing, like the research that I told you about, you might even stay on past dental school. So I think it's just important to find something you enjoy doing. And we can go to the next slide. Applying to dental school, interviews and applications. Okay. Yeah, so the overall application process, difficulties, struggles, when to get started, reference letters, and things like that. So for me, the first time I applied was in 4th year undergrad. And as I told you guys already, my first year GPA was quite low. You know, I almost failed a course. I think it was Bio 121. First year did not go well for me. So I knew that I had to drop my lowest average year, but just to get familiar with the application process, I applied in 4th year. I applied in 4th year and I didn't get an interview, but it was good to just, you know, get used to the application process and see what it's like. And I had a gap year. And during the gap year, I was just tutoring with Tutor Doctor at the time, I think. So I was tutoring and I was practicing literally night and day for the interview, because at the time I was pretty certain that if they dropped my lowest GPA year, which they would have, that's what they said on the website, I was pretty sure that I was going to get an interview. And, you know, even if I wasn't, I just wanted to give the interview my all, my 100%. In terms of the struggles, I think the struggles, The one thing that maybe is harder to undo is if you have a lower average. But, nowadays there's so many options around that. I think it's important to be honest with yourself and ask yourself, what is it that you need to improve on? If it's your grades, then maybe take a couple of GPA booster courses, take a couple of courses in the summer. There was even one person in my class who did a second degree all over. What I'm trying to say is, if you're sure that dentistry is for you, and the only way to be sure about that is if you expose yourself to the dental field by doing research, by shadowing, by being a chairside assist, seeing if this is really something you want to do for the rest of your life. And if the answer to that question is yes, then you have to give it your all. So whether that's improving your GPA, then take a couple of GPA booster courses here and there. Maybe even do a second degree if you really need to boost your GPA. If it's your DAT, then take your DAT, take it as many times as it takes. It doesn't really matter. Nobody really cares or is going to ask you, how many times did you take the DAT? There was one girl in my class who took the DAT 6 times. And it doesn't matter how many, it doesn't matter if you ace it the first time you take it or if it takes you 10 times, as long as you get there. That's all that matters. In terms of reference letters, one of the execs was telling me that you need one from a prof. So that's probably better if it's from a smaller classroom size, or I don't know how you guys do it nowadays. We didn't need reference letters at the time. But the other reference letter I heard has to come from a dentist. So, again, the chairside assist option that I proposed to you guys, that would be one thing to consider. If you're doing a chair side, then you're working and you're shadowing at the same time and you get a reference letter. Or shadowing, I heard that it's recommended, but I would tell you guys that you 100% should consider shadowing. They say it's recommended, but they look really favorably on it. It's something that I think everyone has to do to see if this is a field that they like. And also just to get more exposure. And if it's recommended, but I'm pretty sure it makes a difference. So definitely consider that. Where did I apply to, and where did I get accepted, and why UBC? So for me at the time, I believe there are 6 English-speaking dental schools in Canada. So I applied to UBC and Western. I did not apply to University of Toronto, Manitoba, Saskatchewan, Alberta, because they had physics requirements at the time. I don't know if they still do, but I didn't have any post-secondary physics courses, so I didn't. And I think some of them have really ridiculously high average requirements. So for me, UBC and Western were the only schools where I met the criteria and I had a chance. And I actually got into both. UBC at the time, the interview was really early. I know that now they're doing rolling applications or something like that. But for me, the UBC interview was in January, and we heard end of March that we got in. And the Western interview wasn't until April. Why did I choose UBC? The reason I chose UBC was because my partner was, he was applying for UBC medicine, and he was going for UBC, and I decided I wanted to be in the same city as him. I didn't really pick UBC over Western because of any, clinical or any superior. I don't think UBC necessarily has any superiority over other Canadian dental schools. I think as long as you get into a dental school in Canada or in the States, you're in a good place. So for me, it was just personal reasons in terms of why I chose UBC, but it doesn't matter where you guys get into. I would in fact encourage you all to apply to as many schools as you can. Definitely all in North America, not all of them, obviously, because there's so many in the US, but if it was me, and from what I learned throughout dental school and after graduating and working with dentists and things like that, I would suggest, this is just a suggestion, you guys don't have to take it, but I would suggest that you try to stay in Canada or in the States. Australia, I know that if you do your dental school in Australia, you can just take the board and then start practicing here. But from what I've heard and from what I've seen personally, Australian dental schools aren't really big on the theoretical knowledge aspect of dentistry. For example, occlusion, which is your bite, where in dental at UBC Dentistry, we spend so much time learning about occlusion and bite. So, which is an important aspect in the dental field. We also spend a lot of time learning about medicine in dentistry, which I know it's coming up, so I won't go into too much detail about that. But in Australia, they do a lot of clinical, so they'll do tons of extractions, tons of root canals and things like that, but they barely have any lectures. And from friends of mine who went to Australia, the quality of the work, like they don't really have the instructor to student ratios really basically low. It's something like one instructor per like 50 students or something like that. So nobody's really overseeing your work. So, you know, you might be doing 50 root canals, but all 50 of them might be bad and nobody's really overseeing that. And nobody's really giving you feedback. So what happens is because of their two things, because of the knowledge and the lacking in knowledge that they don't learn in the dental schools in Australia, they have a hard time passing the Canadian boards here. And also the quality of the work isn't quite the same as US and Canadian dental schools. So it's just a suggestion from what I've seen. I know it's easier to Australian dental schools because they take in like something like 200, 300 students a year, some of them, but you know, I would suggest that maybe use that as a last resort as your backup plan. US dental schools, they tend to be very good, both in terms of knowledge and in terms of clinical experience. If anything, they get more clinical exposure than Canadian dental schools. All the Canadian dental schools, they're amazing. It doesn't matter if it's UBC or Saskatchewan or Manitoba, they're all pretty much the same. They're all board accredited. So yeah, so my personal recommendation would be to consider US and Canada, and maybe Australia as a last resort if things don't work out. But there are plenty of good schools in the States. I think I didn't apply to any US schools at the time, but that was my plan. If I hadn't gotten in after my gap year, it was my plan to broaden my application to include the US as well. So I remember New York was a good school, UPenn, Case Western, Reserve University, Michigan is one of the best schools in the world. So, you know, just do your research. There are a lot of schools in the States. There are a lot of good ones. There are a lot of bad ones too, but yeah, so that's just my recommendation. We can go to the next slide. Okay, interviews, MMI and group interview tips. Okay, so UBC at the time, my interview was MMI on, so the Friday was the open house, which was really tiring. It was 8 a.m. to 4 p.m. They just show you around the clinic. They try to sell the school to you. And Saturday was the MMI. I believe it's the same. I think it was 8 MMI stations, 1 break station. And the second day was PBL. It was 4 stations, each station 45 minutes long, but I heard they're not doing that anymore. Sorry, I just saw a question. I got a little distracted, but I'll read it in a second. In terms of the MMI, I'm sure you guys know all about it. You have 2 minutes to read the scenario, and then you have 8 minutes to speak. In terms of the tips, I actually have a lot of good tips to give you for the MMI. I know that for UBC Dentistry, they instruct the interviewers not to interact with the applicants. And they also tell you guys, the applicants, not to interact with the interviewers. I would suggest that you guys take that seriously. I've been an interviewer with UBC, and it doesn't look good when you go in and you try to turn into a conversation, how was your day and things like that. So like, you know, from your perspective, it might seem like you're being nice and friendly, but UBC Dentistry is really big on rules. Everybody has to follow the rules. And once you get in, hopefully you guys will all get in, you'll know that following the rules is really important in UBC Dentistry. So if you're sort of appearing to bend the rules, you know, it reflects poorly. So that's my number one. It's a really simple tip. If they say do not interact with the interviewers, then just take that seriously. And, you might think like it's an awkward silence just sitting there, but it's really not. It's what you're supposed to be doing. The interviewers have been told the same. So just respect that rule and don't appear to be bending the rule. I know some people apply for both medicine and dentistry, and the medicine interview is different in that it's more like a dialogue. The interviewers have a list of follow-up questions, so they'll ask you and then you'll answer, and then it's more like a interactive dialogue conversation basically, but that's not the same for UBC dentistry, at least. It's more meant to be a monologue. The interviewers really want to know about your thoughts and critical thinking ability. They really want to know if you're able to just, instead of jumping to conclusions, if you're able to put yourself in that situation and look at all the relevant scenarios and consider as many angles and aspects of the situation as possible. So try to get comfortable with the idea of being in a monologue type of situation. Don't be okay with awkward silences. There's nothing wrong with it. I know you get 8 minutes to talk. That's kind of a long time, but it doesn't matter if your answer is like, for me personally, there were some stations where I only talked for 5 or 6 minutes long. And then the rest of it, I kind of just sat quietly, and that's okay. It's better to have a high quality response as opposed to be talking for 8 minutes and just be repeating yourself and rambling on. That's not fun. The other tip I have is try not to sound too scripted and too rehearsed. Okay. The questions that they ask for in dental school situations in MMI, whether it's UBC dentistry or other schools, and same for medicine too, they ask really outside the box type of questions. They don't really ask the ethical scenarios that I know there are a lot of interview courses out there. And, I've looked at some of the sample questions that these courses have, and then the questions are really sort of like situational. They're not the types of questions that they get asked in these dental interviews. It's the schools are very smart. They know what's out there. They know what the courses are covering. So they won't be asking questions that's in those courses. They'll be asking something that's really novel, that requires you to think outside the box, think on your feet. So for MMI, I would just say that practice. I told you guys I had a gap year where I was tutoring, and I basically had a whole year to myself. So I knew the interviews at the time would take place in January. That was the norm back then. I started preparing for interviews seriously in October. So October, November, December, and January 31st was my interview. I still remember. So I practiced pretty much full time for interviews for 4 months. So they changed the interviews. Now it's like September and November. So I would say you guys give yourself 4 to 6 months to prepare for the interview, because by the time you get to the interview stage, you've basically everything else you've passed. At the time, if you got the interview, everybody would be on an equal ground. I'm pretty sure it's the same right now too, where everybody, once you get the interview, you're equal as everybody else. It doesn't matter if someone has a higher GPA or a higher DAT score. You just want to ace your interview. I would say find somebody that you know and you trust to give you good feedback, constructive feedback, and practice with the other person. For me, I was lucky to have my partner was going through UBC or Canada-wide interviews at the time. So he and I practiced quite a bit. And there were UBC sessions that started around, I believe, January. It was every weekend where you would just go through station after station after station. It was run by some pre-med or pre-dentistry person, and it was really helpful. At first it's going to be awkward. You're not going to have much to say, but the more you study, the more you read, the more ideas you'll have to share. So practice 4 to 6 months. Try to stay up to date with the news in the world, because that'll come up. UBC Dentistry loves asking news-related questions. They want to know your idea. They'll ask controversial questions too. At the time in 2015, when I was applying, there was a Syrian refugee crisis happening in the world, and I think there were 2 or 3 stations that just touched on that. So right now, for example, there's this horrible war going on in Europe. So expect to see some questions related to that. So for me, what I did was I downloaded the New York Times app on my phone, and I would just read the news. If I was on the bus, if I had any downtime, I would just read the news, read. And there's also New York Times Ethicists. You guys should check that out. It's really cool. It's a page on the New York Times where random people post their ethical dilemmas, and then they're asking for feedback. And there's this New York Times ethicist, I don't know who it is. It's some anonymous person who weighs in on the scenario and gives tips. So I would just say, try to read as much as you can. Read the New Yorker magazine, the New York Times, the Ethicist. Canadian news, less interesting, but they might even ask about the Freedom Convoy in Ottawa. Just try to stay up to date and connected, because believe it or not, it'll really add content to your responses. And basically, just that's what me and my partner were doing. We're practicing full-time 4 to 6 months. We were going to UBC pre-dental sessions, and when we got in, and then when we were in third year of our program, he was in third year UBC medicine, I was in third year dentistry, we actually started to create an app, an MMI app, where it has everything. So I don't mean to be promoting my app, but if you guys want to check it out, it's called Pocket Medical Interview. It's got basically 3 categories of questions: ethical, personal. They'll ask personal questions too, and situational. So just, try to practice as much as you can. And I would say, don't spend your money on courses, interview courses. Like, there are so many out there. At the time when I was applying, there was Astroff, BMO, or something like that. I would just say, these courses, don't trust what they're teaching you, because these are people that didn't get into dental school, didn't get into medical school. So, they don't really, they're expensive courses. I had a classmate who had done one of these courses, and she was telling me that the questions they do are such, easy sort of questions that nobody asks, because everyone knows what's out there. So don't spend your money on interview courses, spend your time on interview practice. Basically practice as much as you can. Find somebody, pre-med, pre-dent, doesn't matter, somebody you trust, somebody who can give you feedback. Time yourself, 2 minutes to think, 8 minutes to talk. And don't be afraid to get feedback. When you first start, like when I first started, I just didn't have much to say. My answers would be really short and really poor, but it was through practicing and reading the news and listening to podcasts and just staying connected and going to UBC practice sessions and things like that, that I really started to learn how to give more content. So practice. I would just say lots of practicing. Give yourself 4 to 6 months. And if you guys do end up going for the app, just give me feedback. If there's anything you guys think, if you like the app or if you don't like the app, I'm open to feedback in terms of that too. But otherwise, you could also Google some questions too. But don't waste your time on the types of on the types of interview questions that seem too easy. Okay, because they'll ask really outside the box, sort of interesting scenarios. And, practice lots, but at the same time, be sure not to sound scripted, not to sound rehearsed. Because if you come off as sounding rehearsed, like, it just doesn't seem genuine, even if you are. So, try to not forget who you are and let that shine through your responses. Be yourself, be genuine, but also be confident. Okay, we can go to the next slide. UBC DMD, Okay, so academic and personal. Most difficult course, favorite course, tips on how to prepare. So I have a lot to say about this, UBC DMD. So I don't mean to scare you guys away, but the 4 years of dental school, at least at UBC, I can only speak to my experience. And sorry, just as an aside, I'll answer all the questions. I know there's 2 questions in the chat. I'll get to those at the end. I just want to get through, but don't just keep sending your questions in and then we'll answer all of them at the end. I just don't want you to feel ignored because yeah, anyway, so in terms of the academic and the personal, so it was, for me, UBC dentistry was definitely the most challenging 4 years of my life. When you're going through dental school, it's stressful and it's definitely hard. But the thing is, there's other people that are going through it with you too. It's definitely going to take a toll on your, physical, mental health. But for me, what really got me through it is once you get through dental school, the rest of it is amazing. There isn't a single day that goes by that I'm so grateful for that conversation I had with my dad over breakfast where he suggested I do dentistry, because it's the most amazing career path you can choose. I'm obviously biased, but I think it's much better than medicine because you do 4 years of undergrad, then you get into dental school, you do 4 years of DMD, and then there's no residency, there's no specialty, there's nothing else, you can start practicing. And the field of dentistry, it's so broad that there's so many different things you can choose to do. For me, in my practice, I'm focusing more on general dentistry and cosmetic because that's what my passion is. But that said, if you're into surgery, if you're into, I don't know, like really fine, like root canal work, there's so much you can choose to, specialize your practice in without having to specialize. And it's really rewarding because you get a mix of for me, it's really important to get a mix of patient interaction, but also doing procedures. So, whatever it is during the 4 years of dental school, just remind yourself that it'll all be worth it in the end. I will guarantee that. In terms of the most difficult course, everything is difficult in dentistry. It's just that in UBC, when you're doing your undergrad, you're taking 4 to 5 courses per term. At least that's how I was doing it, 4 to 5 courses a term. When you come into dental school, I think first year you don't have a choice. You don't get to choose how many courses you take. So I think in first year, you have something like 9 courses per term. In second year, it's 12 courses per term. Third year is also 12 courses a term. And then in fourth year, it gets a little easier. So, undergrad, there's nothing you can do to really prepare yourself for that other than just mentally be ready to be challenged. The first, they changed the curriculum. I was in the new curriculum, which is going to be the same as you guys. They changed the curriculum in 2015. So I was the second year that they were doing the curriculum. UBC Dentistry used to be combined with UBC Medicine for the first 2 years. But they got separated, and then I was in the new curriculum. So that said, you still do quite a lot of medicine in the first 2 years of dentistry. So my advice to you guys once you get in is try to be rational. It's in the first 2 years, you have 12 courses a term, and you do so many medicine courses like GI, neurology, renal, pulmonary, you do all the body systems. Ask yourself, would doing well in these courses make you a better dentist in the long run? The answer is no. So, try to be smart about studying. When you're an undergrad, obviously you need a really high average to get into dental school. That's not the case. Once you get into dental school, 60% is a pass, but you want to stay above 65, 70. That said, just really try to, the way I did it was I put all my energy into my dentistry courses. So restorative, pros, endodontics, things like that. I put all my energy into those dentistry courses because I would say in first and second year, you have let's say 12 courses a term, 6 are medicine related, 6 are dentistry related, there's ethics. So basically just, you have to try to, ration your energy and your studying time into courses that matter in your future versus courses that you just have to do to get through dental school, such as the medicine aspect. That said, the medicine is pretty important for boards, but that's something you'll have to worry about end of fourth year. So, that's just how I would prepare for an increased workload. Explaining how clinical experience works. So it was actually cool. I was in the new curriculum, as I told you guys, the second year that they were doing the curriculum. So we started doing dentistry right from first year. First term, it was kind of stupid. Maybe that's not the right word, but like infection control and things like that. Like you're not really doing actual dental courses. You're just wiping counters and making sure that you're reducing the bacterial load and things like that. And it's the end of first year when you start seeing volunteer patients for, a dental exam. So I guess you get some clinical experience. US dental schools, they start doing restos, I heard, end of first year. So that wasn't a reality for UBC dentistry. It's lower in terms of getting introduced into clinical stuff. You do a lot of simulation where you're doing crown preps, restorations, and things like that on a mannequin dental form. So you do that in the first and second year a lot. And then in third year, that's when you start seeing a lot of patients. Did I have to change my study methods from undergrad? Absolutely. In undergrad, you have to know everything because you need to get 90 plus or whatever to get into dental school. But here it's just not possible. You have 12 courses a term. The final exam period is crazy. They fit in like 3 exams a day, and you basically take 9 exams over a period of a week. So it's just impossible to ace all your exams, and you have to be okay. You have to mentally adjust to that and mentally prepare yourself for that. Change your study methods, try to on the important high yield stuff. Spend more time on the dentistry courses as opposed to medicine stuff. I know that, you're all probably type A, really good students and things like that, but that kind of has to change once you go into dental school. And I think you'll learn with time. In terms of personal, how did I balance school and a social life? What to give up, what to focus on? It's hard. It's for sure hard because school takes up so much of your time. You're in classes from 8 a.m. to 5 p.m. And then starting in second year dentistry, you have evening practice where you can come in from 6 to 9 p.m. twice a week to, practice on the mannequin head, crown preps and things like that. It's definitely hard in terms of your social life. I think for me, what ended up happening was, in undergrad, you have a lot of friends, you might have a lot of friends. And then when you go into dental school, you just have less time for all of that. So you start sort of spending more time with your core group, with a small core group, whether that's your partner or family or a couple of good friends and things like that. Daily schedule, commuting and dealing with long hours. For me, I lived on UBC campus during the 4 years of dental school. And honestly, I can't imagine not living on UBC campus just because the hours are so long, like 8 to 5, and then you come home and you have to study. Or if you're in second, third year, you have evening practice from 6 to 9. I cannot imagine not living on UBC campus. It was so convenient living on campus. During undergrad, I commuted from North Van to UBC for the first 3 years, and then I lived on campus for the last year. But it's really hard not living on campus. So I would suggest living somewhere very close or living on campus, especially second and third year, just because you have evening practice, and that takes up a lot of your time. We can go to the next slide. Okay, additional questions. Let me just go through your guys' question. The first one, Christina asked, do you mind mentioning which schools in the States we should maybe avoid? That's a good question. I don't really know of any schools in the States that you guys should avoid. I've heard good things I've heard good things about New York Dental School. They do a lot of they get a lot of clinical exposure. I heard they even do jaw surgeries in 4th year. So it's really cool. They get a lot of exposure to that. For me at the time, this was in 2015, so 7 years ago, when I was doing research on what are some of the good schools in the US, which are friendly to Canadian students, I think I had narrowed down my research to New York, Case Western Reserve University, University of Detroit Mercy, Michigan is an amazing school, UPenn, and I think those were the only 5 schools that I had considered. I don't know if because they were Canadian friendly or the rest of them weren't. but things have probably changed. I would imagine that there's probably more schools now that are friendly towards Canadian students. So do your research. I haven't heard of any bad schools in the States. I've only heard of bad schools in Australia, but I already told you guys about that. I shared my opinion. I don't know any bad ones in the States, but I'm sure there probably are bad schools in the States too. I can for sure confirm that all the Canadian ones are pretty good, so you don't have to worry about that. And then Jing asked, would you mind sending the name of the app in the chat? So it's called Pocket Medical Interview. It works better on iPhone as opposed to Android, but basically it's just over 500 MMI questions. There's so 3 categories: personal questions, situational, and ethics. And there's a built-in timer, 2 minutes to think, and then it rings, and then 8 minutes to talk, and then it rings. And then in each category, there's a couple of sample answers just to guide your guys' thinking, but obviously not every question has a sample answer. It's just meant to give, my partner and I, we created these questions ourselves from our experiences. I interviewed at UBC and Western, and then he interviewed for medicine at pretty much all the Canadian medical schools, none of the States ones. So we sort of created these questions ourselves. It's copyright protected, just based on our experience, and mostly my partner's experience from interviewing at all the Canadian medical schools. So, they're designed to be outside of the box questions for people that have actually gone through the process and made it past to the other side. It does cost money. It's, I think, $10, 10 Canadian dollars. It's pretty inexpensive compared to the courses, but it's something that, I think what inspired us was when we were going through the practicing for MMI back in 2015, there was really nothing out there that, could prepare you well. The courses, we knew from the get-go, it wasn't the way to go. And, to find questions on Google, it was just kind of, everything was so fragmented and not so many good questions out there. So we came up with the idea when we're in 3rd year, and we made the app. It took us 7 months to come up with all the questions, and then he programmed the app and everything. But we thought there would be other apps, MMI apps, but there weren't. It's just, that's why we came up with the idea, just because it would be nice to have everything in one, like so many questions in one place. And, if you're on a bus or somewhere where you have downtime, you can just start practicing. What was your go-to study method? Cue cards, typing, or writing notes? My go-to study method. Your study methods have to change from undergrad to UBC Dentistry, I would say. Cue cards. I wasn't really a cue card type of person. I personally, if I wrote my notes, it was better. It stuck better for me as opposed to typing my notes. In dentistry, it's all over the place. You'll worry about that once you get there, but it's just writing notes was the way to go for me. And I remember, like, for more difficult courses like biochem, organic chemistry, those types of courses, just like studying and doing as many questions as possible. And I really liked studying with friends. I think it's important to keep the study group small. So pick 1 or 2 friends that you really like studying with, as opposed to making it big. Studying with other people, that was really helpful for me. And, that's something that carries on when you get into dental school too, studying with other people. Do you guys have any other questions? If you guys have any other questions, you can reach me on Instagram too. That's my professional Instagram page. If you guys want to send me a message, just, for tips, advice, or if you have any other specific questions, I'd love to help out. I would just say that it doesn't matter how many times it takes to get into dental school or to, ace the DAT. as long as you make it. So I would just spend a lot of time on improving your application and working hard and, just trying your hardest to, apply as many times as it takes, be persistent, whether it's Canadian dental schools or US dental schools, just take your time, keep applying, don't get disappointed. Maybe some people, they do a master's degree and then they reapply and then they succeed eventually. The thing that matters is whether you make it or not. And if you work hard enough, I'm sure you'll make it. Whether you go to a US dental school or a Canadian dental school, you can take the boards and easily start practicing here. It doesn't matter which school you went to. So I would just be persistent and keep trying. Because it doesn't really matter. So do you need to take a course to become a chairside dental assistant? We're not receiving the messages you sent. Oh, okay. Hold on, everyone. Okay. Your IG account. So my IG account is Dr. Rojan Kiani. Did you guys get that? Yeah. And then the name of the app name is Pocket Medical Interview. Sorry about that, guys. I think I was only sending it to one person as a reply. So do you need to take a course to become a chairside assistant? Nowadays you don't. How it works is, let's say if there's wherever you live, there's so many dental practices nowadays, wherever you live, chances are there's a lot of practices around you. So do your research. And then what I would do is I would either visit those dental practices in person or, either visit those dental practices in person or email them and just say that you're a pre-dental student. Practices love dental students. So just say that you're a pre-dental student and you're hardworking and you're willing to learn more about the field, and ask if you could become a chairside assistant. And there's a huge shortage of certified dental assistants. That's a core. That's, you have to go through the program. And so because there's a shortage of certified dental assistants, a lot of practices are interested in taking on students, and they will train you. Basically, they will train you, they will show you how to do the sterilization, how to do, you get to suction and things like that. It's really hard to get a shadowing sort of position, like even shadow a dentist once or twice wouldn't really be enough. I think it would look really good if you're a chairside dental assistant. For your application, it would reflect, I know the Dean of Dentistry, Dean Mary McDougall, she loves shadowing. She's really big on it. So a lot of practices will just take you on, they will train you, and they'll even pay you, because especially nowadays with COVID, a lot of dentists and dental practices don't want somebody just standing around to shadow. But if you're a chairside dental assistant and you're giving back and you're getting paid on top, that's super helpful. So I would 100%, either visit those dental practices around you in person or email them and ask. They will take you on 100%, because there's a huge shortage right now. And it would just be the best way to get exposure. I know a lot of US dental schools require a certain number of hours. At the time when I was applying back in 2015, a lot of US dental schools required 70 hours of shadowing. But again, with COVID, it's hard to get shadowing. But chairside assist, it's easy to get that, I would say, because there's a huge shortage. For the first year after graduation, I was practicing in a really busy clinic in Port Moody, and we had a shortage of dental assistants, just like every other clinic in the area and in the Lower Mainland. So we actually had a pre-dental student who was willing, she reached out, she heard that we were in need. She lived in Port Moody too, and she reached out, and we basically trained her, and it was really good. And she was basically working full time as a chairside dental assistant. So getting her shadowing hours, getting her reference letter, and getting exposure. And she knew nothing about, just like me, when I was a pre-dent, I didn't know anything. I didn't know much about like how to suction or different procedures and things like that. I just had a vague idea, but I think it took us like 3 weeks to train her. I would say even if you got into dental school before school starts, it might not be a bad idea to work as a part-time dental assistant. Why not? I would do it if I could go back in time. Any other questions, guys? Like I said, if any other questions come up, feel free to message me on my Instagram page. It might, I'll try to respond to your messages in a timely manner. I'm working full time, so it's hard, but in the evening time and on weekends, I'll try to make time and answer your questions, or if there's anything else, if it's about UBC Dentistry and Western. Oh, by the way, one thing I forgot to mention was, at the time, back in 2015, if you hadn't taken physiology in undergrad, then there was a physiology exam requirement for Western. I had to take the physiology exam. It's really easy to prepare for it. I can't remember what it was, but there was this CD at the time that you would buy. It's probably now an online course. It was like a compact course that would prepare you for the physiology exam, and you need 75% to pass, but they'll give you all the information if you get the interview. I can't remember if it was, once you get the interview, then they'll give you all the information for the physiology exam, and it's, you study for it pretty much like full time for a couple weeks, and then you can pretty much like pass the exam 75% or whatever. Western is a good school. It was, at the time at least, it was similar to UBC to get into. But yeah, so yeah, I hope you guys found this session helpful. I tried to share as much personal experience about my journey as possible, but my number one advice to you guys would be to be persistent in your pursuit of dentistry. It's so worth all the efforts and pain and suffering you go through now, which is what I went through to get in. But once you become a dentist, it's a really rewarding career path with a really good lifestyle. You have a lot of autonomy in your job, what days you want to take off, how much vacation time you want to take, and it's really rewarding and it's productive too. So yeah, I would just say it doesn't matter how many times you have to retake the DAT. Don't be afraid to fail. And once you get into dental school too, you have to be okay with the idea of failing and getting back up, failing and getting back up, because I know a lot of us, like, we all tend to be so hard on ourselves, but the reality is, if you don't fail, you're not going to learn about yourself, and you're not going to become a better version of yourself. So just, whatever it takes, just work hard and keep at it, and you'll eventually get in one way or the other. Yeah.
Thank you so much for this session, Dr. Urgent. It's very, very informative, and I'm sure the execs and everyone here really appreciates it. You are very motivational, and reassuring.
I'm glad. I wish you guys the best of luck. I hope you all get in. And if there's anything I can do to help you guys, like before you guys join, I was telling Emily, I was a member of the Pre-Dental Society for a number of years during undergrad. So I was looking for a way to give back. And, I really hope that you guys succeed in your endeavors. And if you're working hard enough to be in a Pre-Dental Society meeting on a Tuesday evening, with all your undergrad courses and DAT studying and things like that, it shows that you're hardworking. And I hope that all your hard work pays off and you get where you want to be.
And then just to add to that, because we're promoting the club a little bit, we're also hiring opens today for this club for next year. And we'll be sending more information along that, like with email and also on our social media. But we're hiring, I think, 3 or 4 more new execs for next year. So if you are interested in joining, that'd be greatly appreciated. And also the applications will open, and you'll get more information alongside that with the lecture slides for today and all of that stuff. But I think that's it. Does anyone have any additional questions to ask? If not, then thank you so much again, Dr. Ridgen, for coming today to us. Hopefully we can have you guest speak again next year, whoever's in the club then. Thank you so much. Having this information session for me today was very informational and just very motivational, I think. Like I've said that, but I think it's like very nice to hear that all our efforts are being appreciated and we're all working towards something.
Definitely. Yeah. Okay. Thanks for having me, guys. Have a great night. Best of luck to you all. Bye.
Thank you.